bhworks has made a big difference in the state of Michigan, because everything from developing the plan of care, obtaining consent forms from parents and caregivers can be done electronically. An email can be sent to them, and that parent or caregiver can sign electronically. Huge game changer for our providers.
In Pennsylvania, we've had good success. We have penetrated nearly every county in the state. We've given our platform to all the behavioral health assessment teams that go into schools for indicated referrals. When teachers say Johnny's not doing well, they send them to the school counselor, and these teams come in and do evaluation.
We've been using bhworks since October of 2015. I remember my first training with Tita and getting the mini iPad and learning how to use that. But since then, we've conducted over 600 SAP screenings. Now we've moved into using the portal and just appreciate the different functions that are available within that. And again, just really positive feedback from families and from ourselves. It's helpful to have this concrete tool to be able to utilize, and then to be able to review the data with students and families.
So we have all of our informing materials integrated into bhworks. So consents, everything HIPAA, or we can email it to parents, we can obtain signatures via the electronic platform. Our phone triage, so for us, when a call comes in, to our mobile crisis line, our staff are going into bhworks, pulling up their phone triage and guiding them through, seeing are we going to respond to this situation or not. We have a really solid risk assessment tool, and we're working with bhworks now on actually expanding our data dashboard associated with that risk assessment tool, so we can get a really good picture of those youth that we're responding to. What are the characteristics that we're seeing? Why are they saying they're suicidal? What means are they saying they're going to utilize? So we're able to, what age group, gender identity, all the demographic data, be able to take a look at that to inform our prevention strategies.
And it's really helpful to be able to use the program. So like your direct services, your discharge summary, your referral, your intake tasks, then load what the clinicians need to complete. It's helpful that my clinicians don't really need to think about it. They can just go ahead and click it, and everything they need to do is there. We do adventure therapy, and so one of those is a squiggle drawing. And so, I don't know if you can see that, but it's a roller coaster. You could tell we would all get sick if we rode this real one. But I just drew a random squiggle, and then your youth has to just create a picture out of it. And so they created a roller coaster, and actually worked really perfectly to talk about the road to recovery, etc. But that might be a piece of paper that I would upload into bhworks to that case note to just kind of signify what we did that day.
We decided, in order to get some more uniform procedures that we really felt like, or some more uniform data, I should say, we decided to agree on some base level expectations for assessment for all students. And so our providers are doing a behavioral health screen on all students. They're also doing a biopsychosocial assessment. No matter what that behavioral health screen is done, after doing those, providers then have the choice to choose what other assessment tools are needed. And so that outlines that for them. Understand that, again, that many of this was put in place because we have so many new providers, and there was a lot of confusion. On what was expected to be done and what we should be doing. And that confusion was resulting in stress in our providers and distraction. And so we felt like, just like kids, if we can create predictable and structured environments, it lowers the stress level and allows people to be able to do their work better.